and welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist for the past 25 years. Have you been having some hip pain? Maybe you have had a hip injury, or you just have no idea how this started. You just gradually started having some hip pain, which is not uncommon at all. Maybe you have been to the doctor and been diagnosed with hip tendonitis, or what's really common, a very common diagnosis is hip bursitis. So if that is you, if that describes you at all, just stay tuned. Let me just talk a little bit more about the hip and about some symptoms and pain you may be having. A lot of my patients that I see with hip bursitis, tendonitis, or just hip pain that started and they're not really sure why, a lot of them will say that they have trouble and pain standing and walking that they never used to have. They just find that maybe after 10 minutes of walking, they have pain. A lot of times, by the time they get to me, they get into my clinic, they might say even just with standing for a few minutes, they have trouble. So just doing things around the house, standing and washing dishes, to household activities, as well as trying to work, they're having quite a bit of pain and quite a bit of difficulty. So let's see, some other symptoms that you may be having is just pain in that hip. A lot of times they'll say it's located on the outside of that hip and may come down into the thigh and generally toward the front of the thigh, into the groin even a little bit, and toward the knee. Now, if you are having pain in that hip, but it actually goes around toward the back, maybe toward the butt, or up toward the back, certainly if that pain is going up toward the back, then you most likely are dealing with a back problem. Pain in the hip, a problem in the hip, will not cause pain in the back. If that is the case for you, then you need to get to your doctor, see a physical therapist, or view the videos that I have for the low back, because most likely you're dealing with a low back problem. I don't want you to start here with the hip, go through this process, and find that your pain is still there. So again, if you have hip pain, but it's actually, you would say that there's also pain, or that pain goes toward the back, most likely that's a back problem. A lot of my patients will describe trouble sleeping on that side now. So they find that over the past few months they started having some hip pain, but now by the time they get to my office, they can't even lay on that side to sleep. Or if they lay on that side, they wake up with pain, or at least by the morning wake up and they are having more pain in that hip. So again, if any of that describes you, then most likely you do have a hip issue, and I want you to give this exercise program a try to see if we can't decrease some of your pain. I would like you to commit to this exercise program for 2 weeks at least. If you do this exercise program like I've directed and like I show you for 2 weeks, and it's not that long of a period of time, so just commit to this for 2 weeks. If you get to the end of that 2 weeks and you find there is little to no change in your pain, then do yourself a favor. Your body is telling you that something is going on. You need more attention, and do yourself a favor, get to the doctor. I'm going to show you about 6 exercises in this program, and I'm going to ask you to do 3 sets of anywhere from 15 to 20 repetitions of each exercise each time you do them throughout the day. And I want you to try to commit to these exercises 3 to 4 times a day, just for this 2-week period. If your pain is better, your strength is better, and your balance is better by the time you get to that end of that 2 weeks, I want you to go on to exercise program number 2 for the hip, and you won't have to do the exercises as frequently. So in the beginning, just stick with me, do these exercises frequently. Like I said, I've been a therapist for 25 years, and I have chosen the best exercises that I know of for this hip program. And I know that they need to be done frequently. We need to remind those muscles and ligaments in that joint what it's supposed to do for you on a daily basis to decrease your pain, increase your strength, and increase your balance, so that you can get back to all those things you need to do.